Usually we just mention the results later. We do not say we did so and we arranged so, because we are going to know that later. So later when you express it, you can say liver enzymes, which was ordered 4 weeks ago, has revealed so and so. Okay. Later when you write it, so that there will be no duplication and you will save words for later. Okay. Okay, go ahead. Dr. Shaukat?
Today patient presented with a complaint of back pain.
Okay, let me check here. Don't write patient, okay? This, some people consider it as the root thing.
So we should say either he presented
no,
or
you start with the name. You start usually with the name. You start the sentence, a paragraph with the name of the patient. Today, comma, Mr. Knowles presented with, okay?
Okay.
Presented with complaints, plural.
With complaint of back
complaints.
pain.
Complaints.
Okay. Complaints of.
Somebody is opening a video. Please stop sharing your videos, please.
With complaint of back pain, huh?
Yes.
With complaints of back pain, pale stool, diarrhea, and abdominal pain.
Yes, with complaints of back pain, pale what?
Pale stools, diarrhea, and abdominal pain.
Diarrhea and abdominal pain. Okay.
Yes.
On examination, comma.
Abdomen was swollen.
No.
Tender.
Why are you just giving new things without an article? Either his abdomen was swollen. Okay. His abdomen.
His abdomen.
Yeah. His abdomen.
Swollen, tender.
I will just mute. Just wait. Unmute yourself, doctor, please. Shaukat, unmute yourself and then continue. Dr. Shaukat. Dr. Shaukat, I have muted all of you. Please unmute yourself. Okay.
On examination, abdomen was swollen, tender, and eyes and skin was yellowish discoloration.
On examination, his abdomen was, you said his abdomen was, and then when you come to skin, you said has. No, just one tense, had yellowish discoloration.
And skin had yellowish. Okay.
His eyes and skin had yellowish discoloration.
Okay.
Or a yellowish discoloration if it's singular.
Pathology report revealed elevated bilirubin, amylase, ALT, and alkaline phosphatase.
Pathology report revealed elevated and amylase and alkaline phosphatase. Okay. It's better to mention that the amylase was high at certain level. Okay. And alkaline phosphatase. Please note.
Patient has underwent polystectomy.
Please note, comma. Okay. Please note, comma.
Okay.
That patient again, Mr. Don't say patient. Yeah. Mr. Knowles.
Right. Has underwent polystectomy.
Okay. Don't write please note, because if you say please note, that means there's something important you want to emphasize it. Just go ahead. Mr. Knowles underwent. Mr. Knowles without please note. Mr. Knowles underwent cholecystectomy for gallstone. It's not has underwent, okay? It's Mr. Knowles underwent cholecystectomy for gallstone in 2008. And yes, comma, and is using
antidepressant medications
fluoxetine
since
no, not is using, has been using.
has been using, yes.
Okay. Again, I think it's irrelevant or partially. It's largely irrelevant. Okay. Okay. Don't write it. Okay. So what we agree about, Mr. Knowles had or underwent cholecystectomy for gallstone in 2008. All of this is not important. Then he is a social drinker. Okay. Or if you want to put it as a verb, he drinks socially. Okay. And he quitted, he stopped, quitted, I think, or quit. I don't know what was the past tense for quit, everyone.
Has stopped smoking.
No, quit is okay, but I just want to know what is the past tense of quit. Is it quit or quitted? I don't know.
لا quitted.
Quitted.
ED في الآخر.
The past participle.
Quitted. Double TED. This is the past participle.
Are you sure?
Yes.
Okay. If it's so, then he has quitted.
Yes, I'm sure.
Yes. If it's so, then he has quitted smoking 10 years ago. It depends on what is the. If you are not sure in the exam, just replace quit by stopped. Okay. Or ceased. He ceased smoke. He has ceased smoking. No, Dr. Shaukat, you said 10 years ago, then you have to write past simple. Okay. If you said 10 years ago, then you have to write past simple. Then you said he quitted smoking 10 years ago, or he stopped smoking 10 years ago, or he ceased, stopped, or quitted smoking 10 years ago. Okay. It's like that. I have discussed with him. Okay,
possible diagnosis.
No, it's not like that. Might be. I know it's common in your language. All Pakistanis write it like this, but it's not actually it's not acceptable like this. Okay. I have discussed with him. No. Usually with him should come last. Okay. I have discussed the possibility of the diagnosis, or I have discussed the possibility of pancreatic cancer with him or with Mr. Knowles. Better like this, okay? With him, it's common in your language, I know. Okay, with him usually comes at the end. It's not at the beginning. You got my point? I have discussed the thing, the diagnosis, the possibility, whatsoever, with the patient last. Okay.
Yeah.
Right. In view of the above, he requires, okay, he needs is informal.
Okay.
He requires an urgent assessment by you and possible endoscopy. I would be thankful. No, this is impolite sentence. Now you are ordering him. He's superior than you. He's a consultant. You are just a GP. Okay, don't order like this. This is unacceptable in English, in formal writing. In view of the above, he needs kida, do it. Just like orders, just like you are a boss now. Don't do it. In view of the above, I would be grateful if you could urgently assess Mr. Knowles and offer him an endoscopy. Okay, it's just like that, or something like that, something polite. I would be grateful, something like that, to just make the life a little bit polite, okay, with the one who's superior. You got my point?
Yeah, yeah.
In view of the above, or in light of the above, I would be grateful if you could urgently assess Mr. Knowles and offer him endoscopy if required. Okay. That's it. Thank you very much. Yours sincerely. Should there be any queries, please do not hesitate to contact me. Yours sincerely, Doctor. Doctor without dot. Okay. Okay. I think
Thank you
today
very much.
you are far better than before. So you are making a good progress overall, and it's a potential good B. Okay.
Thank you very much.
Thank you very much. Thank you very much. Good to see you again. Who's next? The last one, I think, was 11 already. Or maybe لو كتبته خلاص بنشوف يعني. يلا يا شباب.
أنا دكتور ولا الدين.
أحمد صح؟ دكتور أحمد رحمة الله. ده صاحبك هسه قال لي أنا
أحمد
كده.
رحمه الله.
لا 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 الله يرحمنا
أنا
جميعا.
أشوف كده طبعا في مستشفى واحد سيم هوسبيتال اند سيم بليس.
هو قال كده طبعا. هي طبعا انا طبعا احمد رحمه الله دي طبعا سمعتها توايس. سمعتها من فيفيان كانت تضحك طبعا، وسمعتها من اسمه منه. انت طبعا كنت اليوم ده غايب لما جبت هذه احمد رحمه الله. فين احمد رحمه الله؟ انت كنت غايب طبعا، عرفتها؟ كنت غايب.
لكنه طبعا رحمه الله ده اسم الباكستان عندهم كثير.
منو الباكستان؟ صح، عرفتها.
انا دائما يسموا الاسماء دي.
Yes, you are right, 100% right.
So
I'll be sharing your task now.
It is like a difference of accent, like Australian accent or British accent.
Yes, it's like that, but because it's not a common name. It's only common in our country. That's why we prefer it to be like in our slang, rahmatullah, like that. Okay. We're a little bit complicated people. Never mind. Just say it the way you like it. Okay. But just kidding. It's not serious matter. Okay. Dr. Ahmed, if we just go back to your letter, please next time try to write in the official papers to make yourself accustomed to the official papers, and so and therefore in the exam you will be able to just write.
انا عندي الاوفيشال، لكن لما جيت اكتب الخطاب ده
كنت في الشغل.
ان شاء الله ان شاء الله
اخذت لك بريك كده وقبل
لو كتبت ما كان عندي
official سامبل.
ما كان في طريقه اجيب الورقه.
ما شاء الله كتبت على عجله، جاتك افكار
طيب
جهنميه
فوق
فجاه.
30/8/2019.
تفضل.
جاسترونترولوجيست سيتي هوسبيتال. طيب في حاجه في الانترودكشن، فهي ملاحظ.
قصدك في الادريس؟ ما في.
ايوه
Dear Dr. Desai, RE الRE لاين بنخفض سطر يا دكتور أحمد.
الاري مالها
بنخفض سطر من دير، بنخفض سطر بعد دير دكتور ديساي مثلا سبيس سطر فاضي.
لا في سطور.
الله RE نقطتين فوق بعض مستر آدمز نولز ديت اوف بيرث. كده خطك حلو والله ما شاء الله، واضح. طيب اقرا.
لا انا قصدي بين الدي دكتور والريجاردنج في سطر فاضي.
في سبيس ايوه. الحاجه الوحيده اللي ما فيها سبيس
تخلي سطر فاضي، ولا قصدك السبيس
تخلي سطر فاضي؟ ايوه. You got my point? Dear Dr. Desais, خلي سطر فاضي تحت، بعدين اكتب RE Mr. Adams Knowles, date of birth 22/8/1951, just like that. Okay. Space او سطر فاضي. Thank you for seeing. تقرا ولا اقرا لك؟ ما عارف بتاخد لك غطسه كده، ما عارف مش يعني.
ما اعرف والله، انا شبكتي زين دي قاعد تكون دائما تعبانه. لا
زين خلاص، المره الجايه اشوف لك اس تي سي. ما في مشكله خلاص. I will be reading for you،
والله.
وان شاء الله بتشوف الريكوردينج في اليوتيوب اذا حابه. خلاص
آه.
لو ما
طيب.
you cannot catch. Thank you for seeing. لانه خطك واضح، انا بقدر اقرا عادي ان شاء الله. Thank you for seeing Mr. Knowles for F small. I think this is capital what you write here. Okay. Thank you for seeing Mr. Knowles, a 65-year-old. No بعد old ده adjective، لحد هنا adjective ده noun. انت مواصل. Old retired management consultant. ممتاز. comma who has features suggestive of pancreatic malignancy. For your urgent assessment and possible endoscopy. ممتاز، ما فيها مشكلة. Okay, I think لو عملت كوما كان أحسن. For your urgent assessment and possible endoscopy. Because لأنه for your urgent assessment and possible endoscopy دي كده لو جملة منفصلة تبقى vague. تمام. لو دار تربطها بس أعمل كوما هنا، أكتب for your urgent assessment and possible endoscopy. طيب. On the second.
ولا يور ايرجنت تقول او تبدا
تكتب
يور
لو دار تكتب your urgent
ايرجنت
assessment and
ولا
possible
فور يور
endoscopy.
ايرجنت.
your
لو دار
urgent
اعمل نقطه اقول
your urgent assessment and possible endoscopy would be valued.
would be valid ولا would be appreciated. ايوه
المهم
من
خلاص.
غير فور.
ايوه فور دي ما معناه انت حاليا كده يعني، لازم تربطها من الجمله اللي بعديها. اوكي، القبليه قصدي. طيب on the 2nd of August 2019 Mr. Knowles presented with heartburn and indigestion symptoms. لا ما بيحتاج symptoms، شيلها برا. Mr. Knowles presented with heartburn and indigestion. اوكي كده خلاص. or presented complaining of heartburn and indigestion as you like, which was not improved with self-prescribed anti-acid. لا يا دكتور أحمد. which was not improved with self-prescribed anti-acid واحد، ولا with self-prescribed anti-acids مجموعة medications or medications. يعني anti-acid medications تجي مجموعة عشان ما تشيل، عشان ما تاخد ارتكل، ولا خد ارتكل وخليها كده كيفك.
في قلوب الذين كفروا الرعب بما أشركوا بالله.
ذات يو دكتور احمد. انا في القرآن شغال، انا متحرج ان اعمل ميوت للقرآن، فلا بليز
تفضل ما
بليز I don't want to mute the
اعمل
Quran.
ميوت.
I cannot mute Quran actually. اتحرج من الموضوع ده، فبليز don't open recitation while we're the Zoom. Thank you. طيب prescribe anti-acid medications. وضحت لك النقطة بتاعتي. article a self-prescribed anti-acid medication.
ايوه نعم ايوه وضحت.
Okay. Examination at that time was normal.
ولا
examination was normal. his examination مش examination كده مفتوحة، ما تتكلم عن examination. his examination أو on examination he was normal. وأجين قلنا أي معلومة superseded by معلومة تانية أهم منها ما تكتب المعلومة ما مهمة، لأنه في السيشن ديك الإكزامينيشن كان normal، later الإكزامينيشن بقى abnormal. So what's the point? Why are you writing this that his examination was normal? What is this going to affect my ongoing management? No. Okay. So don't write his examination was normal لأنه this is not the last visit. نحن نكتب examination normal في last visit بس. Okay. في previous visit لو اتغيرت الحاجة دي بقى abnormal ما بنكتبها. كلام طبي. أبو حميد.
ايوه تمام مظبوط.
كلام كده. اي superseded ايفنتس لو جاك بكومبلينت وطلعت كومبلينت اقوى منها برضه ما تكتبها. خلاص اوكي. طيب therefore omeprazole was commenced okay and CBC liver function test were requested again. احسن نكتبها بس لاحقا نقول انها اللي طلبناها في قبل شهر كانت كده. On today's review, Mr. Knowles' condition has worsened. He started to develop back pain, diarrhea, pale stool, and abdominal pain. Additionally, he has lost 2 kilogram. He has lost 2 kilogram بس خلاص in weight. عندي اتوقع انه الارتكل انه الريبوزيشن ده كده ما صح. Okay. He has lost 2 kilograms بس كفاية since the previous visit. Okay. And has become jaundiced or has developed jaundice. تكلمنا فيه الموضوع. jaundice. He has become jaundiced دي كده adjective ما بيجي مع jaundice لازم ed. خلاص. His investigations showed high bilirubin, amylase, ALT, albumin, and alkaline phosphatase. Good. Mr. Knowles is married and has 2 children. Oh, this is very irrelevant. Dr. Ahmed Dashno, why are you telling me that he's married and have children? Is that important for me for the ongoing care? Am I going to change my point of view regarding because of this information? This is going to affect whether the diagnosis is true or not. It has nothing to do with the diagnosis and has nothing to do with the ongoing management. So please delete it.
nothing. لكن دائما السوشيال ده بيقولوا مهم في اي حاجه.
ما السوشيال كله. نو السوشيال عنده ريليشن بس. طيب هي
حد بعدين حيكون malignancy ومشاكل.
مهم في حاجه واحده بس انه اذا مرسل الليزون مع دكتور عنده علاقه بالسوشيال وركر. خلاص. otherwise ما شفت فيه شيء ثاني ما تكتبوا على كلمه. Okay. He has quitted smoking for 10 years. For the past 10 years. I don't know whether for 10 years بس has quitted smoking.
عادة الخواجات ده في حاجه كده برضه.
خط قطع. تفضل مستنيك. add your comments. انت الخواجات بحب شنو؟
قلت لك بيحبوا السوشيال هيستوري. مره انا سمعت ستيف في واحده من اليوتيوب ديل تكلم عنه قال السوشيال هيستوري يعني انت رغم انه نوت امبورتنت للحاجه لكن ممكن تدخل يعني.
لا طلقت منه الحاجات الريليتد ولازم تكتب طبعا لازم شفت الباس ميديكال هيستوري سوشيال فاميلي هيستوري ده لازم تكتب منه كلام لكن طلقت منه اللي عنده ريليشن سترونج ريليشن شيب. اوكي. طيب he has quitted smoking for 10 years. okay and كوما طبعا and he drinks socially. Kindly note he did cholecystectomy due to gallstone مش he did cholecystectomy معناه هو اللي مش عمل عملية هو كان دكتور. he underwent. اوكي دكتور احمد.
ايوه underwent. ايوه underwent مناسبة جدا.
in view of the above ماشي.
مش برضه لو سمحت البروسيجر مش قبليها دايما بنحط article.
he underwent a cholecystectomy. Yes, he underwent a cholecystectomy due to gallstones in 2008. طيب in view of the above شنو؟ محمد.
I concern.
كيف concern؟
I concern.
I am concerned. اوي عرفتها؟ لكن عموما ما بتقول له ما توري concerning انت concerned ولا لا ما
زي I believe I concern.
والله ما حصل سمعتها في الاكت دي نهائي. احتمال الانجليزي بتاعي حبه لكن انا ما حصل سمعتها I concern في انا ما حصل سمعتها نهائي. In view of the above اكتب I believe or Mr. Nose has pancreatic.
طيب I believe كويسة.
والله ما عارف انت ليه دار تكتب I believe، ليه دار تدخل رايك؟ ممكن طبعا I believe that Mr. Nose has pancreatic هذا معناه انت خطيت له diagnosis given. هو انت برسل له، انت لو عارف التشخيص كان رسلته طوالي كان has a potential
أنا I
pancreatic
concern
cancer.
معناها أنا I afraid يعني
I'm afraid.
I concern
انت
إنه
لو
I
ده
afraid.
تتكلم بالعربي كده يقول لك I'm afraid that he
أيوة.
might have، دخل فيها possibility. تكتب I believe that Mr. Nose has a potential pancreatic malignancy. لو ده تكتب potential pancreatic malignancy. Okay, I would be grateful if you could manage him at your earliest convenience. ممتاز. Would there should there be any queries, please do not hesitate to contact me.
كده أيوة كده أنا بعد ما أنا
اكتب الاس بدل الدبل الكلام. So yours sincerely دكتور. Very good. Very good ان شاء الله. تعال 200. احمد رحمة الله. When will be your exam؟ في زول ثاني يا جماعة كتب؟ Hello.
أنا والله
شكله بيصلك الأسئلة هنا الكلام متأخر يا دكتور أحمد، عشان كده
دعواتكم لنا بس.
يا رب يا رب يا رب التوفيق يا رب إن شاء الله لينا وليكم وللسامعين وأهلهم والحاضرين كل المسلمين. يا شباب في زول ثاني كتب he wants his letter to be corrected. Anybody here, please? Anyone? في دكتورة واحدة اسمها فاطمة مش عارفة ما هنا السي في ولا ما في. نهاية رقمها 666. She available now or not? Not quite sure actually. We have 7 participants. ما دخلنا والله، خدتنا في الويتنج. فاطمة عبد القادر. دكتورة فاطمة عبد القادر you have عندك حاجة تشير؟ دكتورة فاطمة عبد القادر. This is the last message. This is the last.
Okay.
طيب اوكي سريع كده. دكتور ديف ديساي gastroenterologist City Hospital Houston 30 of August. يا دكتورة فاطمة نكتب August 08 اوكي 30/08 August اللي هي 8 يعني 0/8 08 2021. دكتور ديساي دير دكتور ديساي RE مستر آدم نولز. تقري ولا أقرأ لك؟
ما مشكلة.
Okay, thank you for seeing Mr. Knowles, a 68 years old retired man. Retired man بدل man لأن يعني ما في الكيس ناس اكتبيه صح طبعا اكتبي الاوكيبيشن بتاعه هذا ما خلاص صح. Who has features suggestive ما suggestive. Who has features no who has features suggestive طوالي features verb بعدين بيجي adjective عادي suggestive of pancreas suggestive of ما with pancreatic malignancy. Suggestive who has features امسحي R with غيريها ل of pancreatic malignancy. Your urgent assessment including endoscopy will be valued. Introduction كده كويسة بعد التعديل عملنا. Mr. Knowles presented complaining of back pain, diarrhea, pale stool along with abdominal pain associated with eating and fatigue. تمام. His examination showed abdominal tenderness and mild distension. In addition, yellowish discoloration has been noticed in both skin and eyes. تمام. His weight reduced by 2 kilogram over 4 weeks. He has a weight reduction of 2 kilogram, or his weight has reduced. Okay, by 2 over.
his weight reduced by
has
يا صح هسه
has reduced by 2 kilogram. يعني كنت over زمن.
أقول his weight has reduced. Okay.
أو
Has
he lost
reduced.
أو he lost 2 kilograms in the last he has lost 2 kilogram during the last 4 weeks. Okay, كلها صح. Consequently نقطة لازم تعمل النقطة عشان تكتب consequently bilirubin amylase ALT حالة مفصلة were high. consequently لا 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 كيف الكلام ده؟ تكتب consequently bilirubin amylase ALT albumin and alkaline phosphatase were high. دي ما consequently معناها انت بترتبي حاجة على حاجة. انت consequently على حاجة عملتيها ولا اتعملت ولا كده. تمام؟
طيب أقول therefore كده.
لا ما
therefore it's better،
therefore
صح؟
result consequently و therefore result. وين الريزلت؟ ما result. انت تكتبيه كفاكت ولا تكتبي subsequently؟ انت قصدك تكتبي subsequently.
اوكي subsequently معنى.
لو داير تعمل تتابع وما مهم، لكن لو عملتيه ما consequently للريزلت. subsequently للتتابع. subsequently bilirubin amylase ALT albumin alkaline phosphatases were found to be high. اوكي؟
were found.
لانها ما فاكت، انت عملتيها تتابع لازم تكتب were found to be high. ما في discussion هنا ولا شنو؟ انت عملت شنو؟ therefore دي
therefore
انا بس الكونكشنز كثير ما زي الايلتس، ما بحبوا الجماعه ديل. consequently زي
ما دي كان قاله محمد الفاتح، بتذكر انه لما تكون داير تتكلم تكتب الهيستوري بعدين examination and then تكتب الانفستيجيشن.
ايوه لكن قصدي اني تعمل لك كونكتيف واحد ولا اثنين، ما تكتريها.
اوكي
you got my point. صح في الايلتس، صح بالعكس بيحبوها في الايلتس، لكن في الواي ما بيحبوها. يعني لو جات مره او اثنين ما مشكله، لكن لو بتقدر تكتبها فاكت مجرده ما بتحتاج يعني مثلا انا اديت ميديكيشن يعني زير فور ولا زص مهمه لانها ريزلت لحاجه، لكن من الحاجات اللي ما مشترط فيها التتابع ولا الريزلت اكتبيها كفاكتس. اوكي
طيب ابداها كيف هنا؟ طيب انا كنت داير اربط السنتنس discussion about his condition was performed اللي هو الدكاتره قالوا
انت عندك مشكله، انت كاتبه حاجه المفروض تتقسم في 2 paragraphs عاملاها في 1 paragraph. انت قلت presented complaint of back pain diarrhea stool with abdominal pain associated with eating كده his examination كده presented 200 مرة تاني. انا اعرف دي الليله ولا دي امبارح دي قبل شهر. التايمينج مهم. دي المشكله الاولى، عرفتي؟ وعملت الريزلت دي 200 الشهر اللي فات حقت هسي. انا دكتور بيهمني البروجريشن اوفر تايم عشان اعرف how urgent I should see him. If he's deteriorating rapidly I should see him today maybe if it takes time ممكن اجل، لانه انا كونسلتنت عندي patients ثانيين، فدار لي تايم فريم عشان اعرف انا وين اخذته فيها مهمه فيها اهميه، عرفتي؟ فالتايم مهم، تايم فريمز مهم في كده. دي 2 باراجرافز تمام، ما باراجراف واحده. we're high about his condition. ده شنو انا كنت تاني. therefore discussion about his condition was performed. اوكي عملتها كريزلت برضه. قلت ممكن I have discussed the potential diagnosis with the patient. تمام، او the possibility of the pancreatic cancer in the patient بوضوح. Please note he has been suffering from heartburn and indigestion since last weeks. ليه جايب لي بليز نوت في النهايه كده ومحسساني انها مهمه شديد؟ لانه انت يلصت البوصله بتاعتك، يلصت البوصله لانك ما مشيت في تايم فريم. فانا انت تخيلي ناس انا الكونسلتنت انت كاتبه لي حاجات كده بدون تايم فريم، فجاه تقول لي يا اخي انتبه عنده اعراض بتاعت اندايجيشن، انت قلت لي عنده كانسر ثاني جايب لي اندايجيشن تحت less important صح؟
less important عشان كده كتبتها تحت.
لكن كاتبه بليز نوت.
اوكي
عرفتي؟ بليز نوت دي معناته تنبهيني حاجه مهمه جديد. Antacid was taken but no improvement. I prescribe omeprazole 20 twice per day. فما يمكن بقى ترتيبك للسكيلتون بتاعك لترتيب الايفنتس محتاج كده ارجع
ما
للاوفيشال.
عرفت أنا يلا
انا
فكرة
ذاتي
لأنه
انا ذاتي زيك غلبتني فعملتها بالترتيب العادي، كتبت الفيرست فيزيت كامله وعملتها في باراجراف ثاني السكند فيزيت، وقلت له والله عشان الموضوع ده ماشي كده كانسر، يلا راح شوف الموضوع ده. عرفتي؟
ما عرفت أنا والله صراحة،
ايزر
بس
تكتبها
أنت قلت
بالطريقه
أعمل كده يعني،
ايوه ايزر تكتبها بالطريقه
قلت جيب
الكلاسيكال، او ارجع للاوفيشال سامبل كاتب اكزامينيشن، بعد ذاك الهيستوري كله جراه في باراجراف ثاني. فشوفي الطريقه بطريقتك ما في مشكله، ما في حاجه صح 100%. لكن بس بالطريقه دي كده انا لو ما كنت قاري الكيس نوت ما كنت هفهم حاصل شنو. تمام. regarding Mr. Knowles social and past medical history برضو دي بكتير محمد الفاتح، لكن ما ممكن تمشي بدون الكلام. تكتبي he's a married with 2 children، ليه ما عنده علاقه زي ما علقنا سيدي دكتور. he's physically active برضه ما عنده علاقه. he does not smoke for the past year، قلنا السموكينج والدرينكينج socially مهم. he does not smoke for the past 10 years as a fact. جايبه for the past years 10 years فتجيبي present perfect. he has stopped smoking for 10 years. okay. however he drinks socially. تمام. he had a history of gallbladder removed due to gallstone. تمام. أو he has a history of a cholecystectomy due to gallstones. In light of the above, I would be grateful. I would be greatly appreciated if you could assess Mr. Knowles' condition as you think appropriate. دي طبعا ده التمبلت، وما عملت له اي موديفيكيشن عشان يبقى هنا، عشان يبقى مناسب للكيس ده. فدي مشكله بيعتبرها لك محفوظه، ما بدك قاعد ترجع. In light of the above, it would be greatly appreciated if you could urgently assess Mr. Knowles' condition. Okay. كده. Manage him as you think appropriate. If you have any queries or for further queries, please don't hesitate.
معلش ممكن تعيد الحتة الأخيرة دي، أعمل شنو تعديل
In
مفترض
light of the
يعني
above
ما
هو ده template، لكن اعمل له modification بحيث انه يناسب الكيس نوتس. In light of the above, it would be greatly appreciated if you could urgently assess.
اوكي.
ايوه. assess Mr. Knowles' condition and manage him as you think appropriate, or to rule out the possibility or the pancreatic cancer or to the المهم and provide him with diagnosis. المهم اعمل لك حاجه او خلاص or manage him as you think appropriate، ما في مشكله، لكن بس دخلي فيها شويه شنو urgently assessment. okay. For further queries please don't hesitate to contact me. Yours sincerely دكتور. في الامتحان طبعا ما هتكتبي لي الكلام تحت السطر، ها.
اي
طبعا من هنا وتحت ده ما هيعيل ذاته، هيعتبره ما في. Thank you very much for your attendance. I hope the session was useful for everyone. Pray for me, pray for
يا
yourself.
دكتور شكرا كثير. يعطيك العافية يا دكتور.
الله يعافيك. Pray for me please.
جزاك
Pray
الله
for
خير،
other
ربنا يوفقك إن شاء
for
الله
other candidates.
وينزع حسناتك إن شاء الله.
الله يديكم العافية. في أمان الله. Thank you very much.
لو سمحت بس سؤال أخير دكتور.
تفضلي. عندنا دقيقة حيقطع السيشن.
هاي بس الريكورد بلقاه وين الريكورد حق السيشن دي؟
أنا والله بس كنت كسلان، في 3 سيشنز ما رفعت الريكوردز في اليوتيوب، حارفعهم وأنزل لكم اللينكس إن شاء الله.
برضو معلش في اليوتيوب بتنزل يعني الرابط ولا كيف؟
برفعهم في اليوتيوب بنزل لكم الرابط في الجروب.
خلاص تمام، بس عشان التصحيح حقي أنا في حاجات كثيرة ما فاتت عليه عشان.
طيب تمام. Thank you very much إن شاء الله.
شكرا جزاك الله خير.